Hey everyone, we're just going to give it one more minute while everybody has a chance to log in. Okay. Well, hello everyone. Welcome to our latest NURA webinar. I'm Dr. Erin Slingster-Schmeyer from the Physicians Committee for Responsible Medicine, and I am hosting today with a ton of behind-the-scenes effort from my colleague, Allison Martin, who you'll find in the chat today. In case you haven't joined a NURA event before, welcome. NURA is short for name used for regulatory application, and through it we offer free training opportunities on all aspects of new approach methodologies. All NURA events are recorded and made available for free on our website at pcrm.org/NURA. You can find more information about this and future webinars at pcrm.org/NURA training. Here you can find more detailed information about our speaker and the presentation abstract. Shortly after today's webinar, you'll also find links to the recording here as well. Today and always, we want to hear from you. Please feel free to join in the conversation. There will be plenty of time after the presentation to take any questions that you may have. We ask that you only use the Q&A module to share your questions for the speaker, as it makes it a lot easier for us to keep track of them. This also helps me prioritize questions that you want answered by allowing you to vote for questions with a thumbs up button. You can use the chat to make any general comments or ask us any technical questions. In fact, you can practice right now by saying hi in the chat and letting us know where you're checking in from. Please feel free to reach out to us via email during or after the webinar with any questions or feedback at nura@pcrm.org. At the end of this webinar and in a follow-up survey, email, you will find a Google Forms link for a brief survey. By taking literally 1 to 2 minutes of your time filling out this survey, you can help us continue to improve these webinars. And please don't be shy. Let us know what you liked, what you didn't like, and drop us any ideas you have for future training sessions. Before we get started, I wanted to let you know about some other free NAMS training opportunities. First, I wanted to introduce our new learning platform. Find out more at pcrm.org/NURA, by using this new platform, you can review our long-form training content at your own pace, and the platform will keep track of your progress. Additionally, we've made our videos more accessible with English and Spanish subtitles, and we're currently exploring Chinese subtitles with select webinars as well. Upon completion of the course, a certificate of completion will be generated that you can submit for continuing education credits. And this is just the start of making our content more accessible. More programs will be available very shortly, so go to pcrm.org/NURA to sign up today. Okay. In just 2 weeks, we will have another NURA webinar on our second FDA case study of human-based methods in FDA submissions. Join us on October 10th for Dr. Sandra Smizik to tell us about Vanda Pharmaceuticals' experiences using NAMS in lieu of animal studies. Then, on October 17th, we'll have Dr. Marc Audebert talk about his in vitro genotoxicity method and its use in chemical risk assessment in our NAMS Spotlight second webinar. There are a lot of exciting webinars coming up, and you can register for this or other upcoming NURA webinars at pcrm.org/NURA. The dynamic discussion series on gaining confidence in next generation risk assessment approaches continues with 2 more webinars this November 14th and the 21st, both at 10 a.m. Eastern or 4 p.m. Central European Time. The registration details will be available very shortly, so keep an eye on our website for these and other upcoming webinars, or sign up to our mailing list to stay informed. And finally, today, I am excited to introduce the first speaker of our NAMS Spotlight series. Dr. Randolph Ashton works at the University of Wisconsin-Madison, where the goal of his research is to bioengineer human tissues that can be used as tools or therapeutics to prevent or cure central nervous system disorders. In his research, he melds state-of-the-art biomaterial approaches with novel human neural stem cell derivation protocols to bioengineer brain and spinal cord cells and tissue models in vitro. In 2021, he co-founded NURA to translate his academic lab's innovations for developmental neurotoxicity, neurodevelopmental disease modeling, and drug discovery applications. Again, for more details on Dr. Ashton and NURA, I encourage you to check out our website at pcrm.org/NURA-training, and we'll also put a link in the chat for more resources that he's provided you guys as well. In this webinar, Dr. Ashton will present on the RosetteArray platform, which enables quantitative high-throughput screening of human developmental neurotoxicity for chemical risk assessment. And with that, I want to say welcome, Dr. Ashton. We are excited to hear from you, and you can go ahead and share your screen.
Awesome. Can you hear me and see my screen?
Everything is great.
So awesome. So thank you for the opportunity, and thank you for all those who are attending. So as was mentioned, my name is Randolph Ashton, co-founder CEO of NURA, and we are commercializing our RosetteArray platform, which we think is an excellent tool for quantitative high-throughput screening of human developmental neurotoxicity and other applications, which I'll talk about as well. So just a little bit about NURA. So our main goal and focus right now is to push our RosetteArray assay as a human D&T regulatory standard. So we really got going in January 2022, and this was with a STTR grant from the National Institutes for Environmental Health Sciences. This is basically for scale up and validation of our RosetteArray platform, and we are making excellent progress in completing that grant very soon. We also have partnered with the EPA, and this was to use their TOSCAS library in order to conduct our validation D&T screening, and this is going well. I'll show you data from that as well. And then we became really commercial in terms of selling our RosetteArray consumables and screening services in August of 2023. So we licensed technology from the University of Wisconsin-Madison and are able to fully provide cells as well as plates and conduct commercial screening activities. So please contact us if you are interested in using this tool. And then we've had several publications that have come out, including one that is on using the RosetteArray to detect genetic risk factors that cause autism spectrum disorder. And we also have now our proof of concept for human D&T paper, and as well as modeling spina bifida genetic risk factors, chemical and genetic risk factors. And that manuscript is on bioRxiv. It's currently in review. And we have, over the past couple of months, really started to attack the presentation scene to increase the awareness of our platform by presenting at a number of conferences that we've been invited to based on the work that we've done, including the International Conference on Developmental Neurotoxicity that was over in Germany earlier this year. We have presented to the National Toxicology Program, also known as Division for Translational Toxicology at NIHS. At the Neurotube Defect Conference, we participated in the workshop for novel alternative methods for DART testing, and we will be presenting at the ASCCT annual meeting as well as the American College of Toxicology. So these are the places where you can catch us. We'll be in person at those meetings. So our RosetteArray platform is essentially a novel tool that can be used for in vitro risk assessment of chemical and genetic factors that essentially have the risk for perturbing human brain and spinal cord development. And the context in which we currently sit, the Organization for Economic Cooperation and Development has provided a guideline for an initial recommendation for a guideline for developmental neurotoxicity in vitro battery. And these are assays that were developed several years ago. You can see that the battery here contains about 17 different assays. But one thing I want to note here is that when you're looking at the time course of human brain and spinal cord development, the vast majority of these assays sit after you have the formation of innate barriers, such as the blood-brain barrier and the placental barrier, which really wall off the central nervous system very early in development, and then the placental barrier walling off the embryo. So it's always a question of whether compounds even get to the central nervous system tissues when you're testing for assays that are exploring development after these barriers are in place. And what you'll notice is that there's a period between conception and the first roughly 6 to 7 weeks of development that there really aren't any assays currently analyzing development in that area. And this is really important because this is a really high risk area because it's prior to the formation of those barriers. So things get to the embryo in this time period. And also what we know now from multiple Nature papers and other papers is that the initiation of neural tube defect pathogenesis, as well as events that cause autism spectrum disorder, really start in that earliest formation of a structure called the neural tube, which is in this 4 to 5 week period. So we think this is a really high risk area. And what we now have in the field of science is organoid technology, which allows us to take human stem cells, human pluripotent stem cells, culture them as aggregates and guide them down the neural differentiation process. And we can essentially recapitulate the morphogenic events, the formation events of brain and spinal cord development using these organoid tissues. So it's a very powerful platform. But the platform itself in its standard format has issues with reproducibility and scalability. And at NURA, we wanted to harness that organoid technology in order to model this earliest stages of human CNS development, this what we think is the most risk relevant stages of human CNS development. And that is where our RosetteArray platform comes in. Not only can we look at forebrain or brain development, but we can also look at spinal cord development and cover essentially the entire axis of the developing CNS. And this is the advantage that our RosetteArray platform provides, is that we're screening at this very critical period where the embryo is exposed, where the earliest stages of forebrain and spinal cord development take place, and where we know pathogenesis for flaggable events such as neural tube defects, spina bifida being one of those, as well as the induction of autism spectrum disorder takes place. So the very tangible problem that we're trying to solve is that essentially chemical and pharmaceutical companies for decades have not had the ability to assess how their compounds affect early human brain and spinal cord development. And this basically in their development pipeline, not until they get down to potential candidates that they're trying to push through the development phases will assays be conducted for looking specifically at developmental neurotoxicity. And this is largely done with OECD guidelines, animal studies. And in the case of most compounds that are tested, they're not tested on pregnant females. And so you never really have a potential for testing a chemical's possible effects on human DNT until after it's been released after your clinical studies. And the problem lies in the fact that we all know that rodents are not humans, and so things can slip through the cracks. And indeed, they have done this for EPA-approved chemicals and pesticides, as well as FDA-approved drugs, leading to cancellations and restrictions that overall increase the risk, time, and cost for development of your chemicals and pharmaceuticals. So NURA's solution to this has been to use human pluripotent stem cells to bioengineer human brain and spinal cord development in a dish. And the structure that we are essentially modeling the formation of is this neural tube structure. It goes from the head to the tail of the embryo. Can you guys see my pointer?
Yes, we can.
Excellent. So it goes from the head to the tail of the embryo, and this is where all brain, retina, and spinal cord tissues derive from in the human embryo. If you take a transverse section of that, you can see that each one of these blue dots, these are the earliest neural stem cells, and it essentially forms a annular tube and that we call the neural tube. Each one of these neural stem cells is polarized so that it has tight junction proteins on the interior surface of this neural tube structure. The canal that's in the middle will become your ventricles and your spinal canal, and then it deposits extracellular matrix proteins on the basal surface, and this is essentially how it walls itself off very early in development. Now, we've been able in the field of stem cell technology for about 2 to 3 decades now, well, 2 going on 3 decades, been able to take human pluripotent stem cells and differentiate them into this early neural tube neural stem cell phenotype. When you do that, they spontaneously form these rosettes. So hundreds of these neural stem cells will aggregate and try to form these polarized structures. Essentially, they have the instructions and the machinery to carry out this process. They try to do it, but as you can see from this image here, the rosette formation is random in space and time. And what we've done at NURA is combine this with our micropatterned cell culture technology. And it turns out that if you get the length scale of these cell culture aggregates at the right size, then you predictably and efficiently can standardize the formation of these singly polarized rosette structures mirroring transverse slice of this neural tube. And that is really the basis of our technology, is that we are standardizing this rosette emergence process that is an analog of neural tube morphogenesis. And then we can simply look to see when that has been disrupted. Now, I'm going to show you confocal images throughout the rest of this talk. And so you'll see sort of that standard rosette morphology, but I want you to understand we actually seed our culture plates with human pluripotent stem cells. Here is a monolayer, but since they can't grow in the X, Y, Z direction, they grow in the X, Y direction, they grow in the Z direction. And they're forming a three-dimensional aggregate of cells that has this polarized structure, which you'll see in a minute, in the middle of that aggregate. And indeed, if we, for example, put a hydrogel on top of these surfaces, then these will form three-dimensional spheroids and pop off the surface. And so that rosette structure that you see in the middle there is what we are assessing in our assay, as well as their ability to become neural stem cells and the overall cell viability and proliferation of these cells in this process. So fast forward a couple of years from that discovery, and we have now a scalable off-the-shelf pipeline, which we call the RosetteArray platform, that we can use for chemical screening. So we've developed a number of protocols to derive neural stem cells from all different regions of the human brain and spinal cord. We can take our pluripotent stem cells or early stage spinal progenitors, see them directly onto our RosetteArray substrates, which we manufacture in-house and can provide these if you want to do this on your own, in your own facility using your own cells. We can provide the actual plates to you. Depending on the region in which you're trying to model, whether it's forebrain versus the spinal cord, the culture period is 7 or 5 days, and you can expose those cells to various chemical factors. You can flip this on its head for drug discovery using disease model cell lines, and then use a drug library to screen for things that can ameliorate the risk effect that you detect in the system. But for chemical screening, you apply the chemicals really from a day after you seed through the end of the culture period. And at the end, you have well plates that have arrays of these rosettes, roughly 150 for forebrain, up to 500 individual tissues per well in a 96 well plate for our forebrain and spinal rosette arrays. We typically look at 2 compounds per plate. We do 8-point dose responses for our standard dose response curves. And then you can basically go through and image tissues within each well in order to run it through our AI-based Rosette Detect software. This software will screen all the images from a plate. We typically in-house look at about 3,000 images per plate, and it will scan those tissues and then spit out the data so that you can generate your dose response curves. Looking at cell viability proliferation, that's just the number of DAPI stained tissues within the rosette slice. Looking at neurodifferentiation, that is whether you have achieved PAX6 positive neural stem cells and the number of those cells within that slice, and then also looking at rosette formation. And as you can see, for a sort of reference compound, methotrexate, which is known to cause clinical neurotube defect risk, we get very nice dose response curves. Our rosette formation metric being the primary metric, but that's not always the case. So we can basically have really unprecedented statistical power because of the number of tissues that we're analyzing in our RosetteArray platform. We can gain some mechanistic insight into which potential pathways are being affected based on the juxtaposition of these curves, whether the rosette formation is offset, orders of magnitude to the left in terms of its IC50 versus the other curves or not. And because we can analyze these tissues now using our AI software, this is extremely scalable. just to kick the tires a little bit on the AI software, what that is doing is it takes the Z-stack of your Rosette array tissue, the individual tissues that you've collected, takes each one of those slices, splits them apart into the stain channels. Again, we're staining for the cell nucleus in DAPI, a cell-to-cell contact protein, and incadherin. That's actually what's polarizing to show us the rosette structure. It also indicates that you have neural tissues. And then we also look at PAX6, which is a transcription factor, the deterministic transcription factor for generating neuroectoderm in the human developmental biology. And so we're looking at those basic cell counting that we use for the DAPI stain, for the PAX6 stain to show us that we have neural stem cells. And then for the rosette detection, we have amassed lots of images, trained AI software, and have really good efficiency metrics for that software for predicting whether you have a rosette or the initial formations of a rosette within your tissue. And so this is all in the bioRxiv preprint that's online. And if you want to know in depth about the platform, then please look at that. And ultimately what this does is it spits out the data. Again, we can gain some mechanistic insight into potentially what is being affected based on the metrics that we pull off. We do have a metric that's not here, which is simply the number of tissues we can analyze per well. And that is a metric which we really use to show cytotoxicity. It's very stark because we're exposing our tissues to chemicals over several days. So you basically go for a concentration where we're detecting as many tissues as we need to do the analysis to a concentration where that is 0. And that's where we know that we're hitting just general cytotoxicity. Also, again, the statistical power of this assay is extremely high, giving us really high sensitivity for detecting effects. We have solvent positive controls as well as a solvent control on each plate. And again, we do full 8-point dose response curves covering 8 orders of magnitude when we're screening chemicals for developmental neurotoxicity. So what this allows us to do, because we can scale this and provide it at a reasonable price, we can now provide this as a service, really for assaying or rank ordering human D&T risk for compounds at the lead optimization stage of discovery. And so we can help provide enhanced understanding of the potential toxicity of your compound for affecting human brain and spinal cord development. And of course, that can lead to significant savings in the overall process by not taking those risky compounds forward. Overall, we're reducing the risk, time, and cost of your process, and we're glad to do it, as well as increase the general safety and wellness of the human population. So a fundamental question, of course, that everyone has is how good is the Rosette Array at predicting human D&T? We are still answering this question fully, but we have some data that I will share with you now. First, a couple of notes on our assay and what it can do. So as long as your compound can be solvated in dimethyl sulfoxide or water, of course, then we can screen it. And so DMSO does not affect our assay up to the 0.1% concentration, which basically means that our stock solutions, if your compound is dissolved fully in DMSO, the highest concentration that we can test is the 1 to 1,000 dilution of that. And that works out well to be in the 10 to 100 micromolar range for most compounds that we've seen. We have really good reproducibility of our assay. We've now analyzed this up the wazoo. So this is a heat map showing the percent of single rosette emergence across a 96 well plate. We use the interior 60 wells. The exterior wells are essentially a buffer so that we don't get any evaporation effects. And you can see whether we're using a liquid handler or doing it by hand, we get really good efficiencies, upwards of 90%, 85 to 90% efficiency in rosette formation, really across the plates, and good homogeneity of rosette formation across the plate. When we look at a Z-factor analysis, and this is the first time that we've seen this type of analysis for a pluripotent stem cell derived morphogenesis assay or organoid assay, we have a Z factor that is greater than 0.5, which indicates that we have a good assay that can be used for quantitative high throughput screening. And here we're looking at the difference between our solvent control as well as our standard reference positive control, which is methotrexate at 1.0 micromolar, in terms of the values or the separation of those values over the course of multiple Rosette array plates. We now have this out to at least 30 to 40 plates, and it has stuck around this 0.55 is actually our current reading. So it's gotten a little better. The other thing that we can do, which is somewhat unique, is our assay is tolerant of our ability to simulate human metabolism. And the way that we do this is that we can use S9 pool liver fraction. We simply buy it from Thermo Fisher. We can conduct a predigestion at 2 mg per mil. That gives us efficient metabolism of most compounds. We can analyze those for an additional fee to see how much metabolism we get using the core mass spec facilities here at the University of Wisconsin-Madison. And then we can start with the 1 to 1,000 dilution of that digestion in order to test a metabolized form of your compounds in our assay. And ultimately, at that 0.002 range, we really don't have any effect on any of the metrics of our assay. So we started to run some data using sort of D&T reference standards in our assay to see how our assay stacks up to some of those in vitro test guideline battery assays. And so we have a couple of examples here of full dose response curves, as well as some of the AC50s for these various assays in that D&T battery for these compounds also indicated. And you can see by and large, our assay overlaps with hits from that D&T battery. We're doing a more in-depth analysis of this, of course, and that should be coming out soon, and at least by archive manuscript, and then published hopefully sometime this year or early next year. But as you can see, for sort of low risk compounds, we tend to think of things as low risk as having a hit of 10 micromolar or greater. If you're in the 10 micromolar to 100 micromolar IC50 range, then you probably have a little bit of concern there. Of course, these compounds such as imamectin benzoate is still commercially sold, but you just have to be sure that you will conduct good IVE, and PBK modeling to understand risk factors there. And then, of course, you have high-risk things that give us IC50s less than 100 nanomolar in our assay. Again, you have to conduct the IVE and PBK modeling, but what we see for sort of real well-known standards of developmental neurotox risk factors, we see those giving IC50s at points lower than 100 nanomolar within our assay. And we're going through now doing a blinded screen of the TOSCAS library. These are basically compounds that overlap with that OECD guideline list of compounds so that we can compare to that assay. And we're doing this with the EPA. And so we've screened a number of compounds now. We're up to 50 compounds, and you can see sort of the positive and negatives are largely aligned. Overall, right now, we have a sensitivity that our assay should detect these toxins. It does so 87.1% of the time. And our specificity currently sits at 100. But just a caveat here, we only have an N of 3. Negative controls are hard to come by. So we are increasing the number of negative controls that are agreed upon by the general community to test in our assay as well. But by and large, with this number of compounds studied, we don't expect these numbers to change drastically. And so overall, this seems like our assay ranks right up there with any other D&T assay, which are typically have values of 80% or higher for these two metrics. Now at NURA, we're actually are not toxicologists, we're stem cell biologists. And so we have learned sort of in toxicology that you do those standard chemical lists, and that's how you validate your assay with the general community. But we actually started off with a much more broader question, and that is, can our assay detect factors that take the normal developmental process, which gives rise to a baby with normal cognitive and motor function, and alters that? And can we detect any of the really well-known factors, chemical or genetic, using our assay that causes these alterations? Things like spinal bifida, autism spectrum disorder, and even neurodegenerative disorders now, the predisposition to that is the pathology that leads to that predisposition is now thought to occur very early in development, and you just don't see the disease until later in life for those who have additional hit factors that cause them to push into the disease state. And so we know that these disorders, or your susceptibility to these disorders, is based not on just one gene mutation, but multiple gene mutations in your genetic background, as well as the environmental factors that you can come into contact with, either during the early gestation periods or later in life in terms of neurodegenerative disorders. And the problem is we really don't have good technologies that can screen this large space in a multifactorial way effectively. And so we think our Rosetta Array technology can potentially help provide this type of tool to conduct these analyses. And indeed, we have modeled spina bifida, 2 different genetic risk factors that cause spina bifida in our preprint. In this Nature Neuroscience publication, we collaborated with Georgia Quadrado at USC, and they show that we can detect 1 genetic risk factor for autism spectrum disorder. And the lab of Ali Birvanloo over at Rockefeller has shown that NURA rosette formation can be used in order to detect the genetic predisposition risk for Huntington's disease. So we'll start with our data on neural tube defects. And again, we're just here going to look at the chemical risk factors and can we detect chemical risk factors that have really well validated clinical data on increasing the risk for neural tube defects. And so we use glycolic acid as our control. Here we're using our 4-brain Rosetta Array platform to look for spina bifida risk. We have methotrexate, valproic acid. These are compounds that are restricted from being used for anybody who is conceiving or has the potential to conceive in the hospital setting. And here we see that the Rosetta Array metric, the Rosetta emergence metric, is the most sensitive metric, and we get nice dose responses for both of these compounds. And then we also looked at Benamil, which is a pesticide that has been epidemiologically correlated to cause neurotube defect risk. And here we see a different dose response profile where all of these curves, they're not statistically different, they largely overlap. And so we think largely Benamil is affecting normal cell physiology processes causing that potential developmental neurotoxic effect. We've also looked at more contemporary molecules such as dolutegravir. This is a HIV antiretroviral therapy drug. It has a high therapeutic range, 3 to 10 micromolar within the blood serum. And when it was tested initially in clinical trials, it came up with a increased risk, about a 3-fold increased risk for causing or having pregnancies that resulted in neural tube defects. And so this set off an alarm at the WHO. And indeed, when we test dolutegravir within our assay, we get a nice dose response really at that 1 to 10 micromolar range, so overlapping with that therapeutic range, indicating that it has this risk. It's been well shown now by multiple labs that dolutegravir somehow interacts with folate receptor pathways, which is a main pathway that can cause risk factors for neurotube defects. Likely, and subsequently, if you are to mandate folic acid fortification of your food supply, then in those countries, they don't see this risk for dolutegravir. And indeed, when we do a dose response for when we do a dose response for metabolized folic acid at the IC50 level of dolutegravir, then we can also see an ability to mitigate this risk that's caused by dolutegravir, essentially mirroring what has been seen in clinical trials. And so this is just further validates that our assay can detect risk factors that are known clinical causes of neurotube defect risk. Now, neurotube defects is a complex disorder, and it has both genetic and chemical or environmental contributions to, or is believed to have genetic and environmental contributions to most spina bifida cases. And so we looked at that main pathway that's known to cause neurotube defect risk, folic acid metabolism pathway. I will note that methotrexate actually inhibits this pathway upstream, causing that risk for neurotube defects. If you supply the metabolized version of folate downstream, you can rescue or mitigate that risk. And also, amongst 37% of the US population and similar around elsewhere around the globe, there is a common variant for the enzyme that is the critical enzyme in this pathway. And that variant actually also increases the risk for having a pregnancy affected by neurotube defects. And across 19 different clinical studies with over 6,000 participants, they have seen that if you are heterozygous versus homozygous for that risk, you have an odds ratio increase of about 40% for having a pregnancy afflicted or affected by a neurotube defect. And so we wanted to see if our Rosette Array could detect, perturbations to this pathway, particularly genetic risk factors that can cause an increased prevalence of neurotube defects. And so we created gene-edited lines. We had our H9 line, which is actually heterozygous for this variant in the MTHFR gene. And we created two homozygous lines, the MTHFR9 and 4 lines, using gene editing. And interestingly, when we ran our control assay, which is just running the 4-brain Rosette Array assay, we saw no difference in rosette formation between these lines. But as soon as we challenged them by knocking down this pathway's efficacy using 1 micromolar methotrexate, now we see the increased risk for the heterozygous versus the homozygous case. And of course, we can rescue all 3 cell lines by adding in the metabolized folate on the back end. And so this was interesting to us. And so we ran full dose response with methotrexate for both our heterozygous and homozygous lines. And when we did this, we saw that we had an increased increased sensitivity based on the IC50 for our homozygous line versus the heterozygous wild type control. And this is interesting because we essentially ran 2 4-brain Rosette Array plates, analyzing over 6,000 rosette tissues. So we did basically this twice. And we saw that when we have that level of statistical power, our 95% confidence intervals, they do not overlap between these curves. And so these are statistically significant differences between these 2 curves. Even more interesting is that the IC50 ratio for these curves is approximately 1.4, which is basically the same as the odds ratio that was seen across 19 different clinical trials. Here, again, we're highlighting the sensitivity of our assay and the power of just using 2 4-brain Rosette Array plates to essentially see similar magnitudes of increased risk caused by the homozygous versus the heterozygous case, as was seen in or across multiple clinical studies. So we really think our assay is powerful in detecting factors that are known clinical causes of neurotube defects, particularly spina bifida. And we also have data now for autism spectrum disorder, particularly looking at genetic risk factors for autism spectrum disorder. And for this, we collaborated again with Georgia Quadrato at USC. And she had a patient there that had a SYNGAP1 mutation. It had a heterozygous mutation in that haploinsufficient mutation, meaning 1 copy was not working in that patient. And that patient had severe intellectual disability and was diagnosed with autism. And essentially, what they have seen is that SYNGAP1 is a mutation that is well known, one of the highest risk factors for causing autism, and it actually represents approximately 1 to 2% of all intellectual disability cases. So when they ran the assay using a standard NURA organoid assay, so this was a 2-month cortical organoid derivation assay, they saw that when they analyzed these tissues, 2 months to grow the tissues, not to do the analysis, that is actually much longer. But when they grew the tissues, they saw that these green areas here, these are the rosette areas within your neural organoids. They saw interesting differences between the corrected version versus the patient organoids. And they quantified these here, but they weren't satisfied with that quantification. And when Georgia Quadrato saw me give a presentation on our Rosette Array technology, she asked if they could try to use it to see if they could better quantify the differences they were seeing in the formation of these ventricular zones or rosette structures within their neural organoids. And we gave them that assay. They have experience with pluripotent stem cell culture. They got it the second time trying it, essentially. And what they showed is that for that patient cell line, when they tried to form single rosettes, they had a really abysmal efficiency of forming these single rosettes. But when they did the exact same thing with a CRISPR edited and corrected cell line with a CRISPR edited corrected version of that same patient cell line, now they could drastically increase the efficiency of their single rosette formation. They also did this in a control iPSC line. But one thing I want to highlight is that this is an 8-day assay versus 8-day assay for culture and analysis versus their 2-month assay just for culture in their normal organoids. They also verified this by putting this haploinsufficient mutation into a iPSC control line. Again, they saw abysmal performance in generating these single rosette structures. And then they also used the control line itself and saw that that had really good efficiency, indicating that this haploinsufficient mutation was causing this inhibition of rosette formation. And they did further studies in their organoids as well as in mouse models to show that this was causing the autism spectrum disorder that was in that patient. So to sort of summarize things, we think our RosetteArray platform is excellent at predicting both chemical factors that would be good for DNT risk assessment, as well as genetic factors that would be good for overall neurodevelopmental risk assessment of patient iPSC lines or modeling of neurodevelopmental disorders. And we hope that people will use this tool. In the context of the in vitro battery, this is where our RosetteArray platform lies. I showed you a lot of data for forebrain RosetteArrays. We have similar data for spinal cord RosetteArrays for detecting neurotube defect risk. I just didn't want this seminar to run too long. And we think this is a critical area because it's before you have innate barriers that wall off the CNS, and it is where some of those flaggable birth defects, neurotube defects are detected within the first trimester. The testing they do, I think, is typically at 16 or 24 weeks to test for neurotube defects. So by the time you get to the second trimester, you can detect whether you have this. So it's very early in the gestation and development stages. Also, autism spectrum disorder is detected now before 24 months post-birth. And so these are flaggable events that can be directly tied to chemicals that are out there in the community if they're causing an epidemic of these events. And so we think that for those reasons, this RosetteArray platform is really useful for decreasing your risk of having compounds that you put into the marketplace that can cause those effects. Just to summarize again, the RosetteArray platform, overall, this just simplifies human DNT screening. It works with DMSO solvated compounds. We have really good reproducibility in our forebrain and spinal RosetteArrays. Z-factor score is high, indicating it's a good assay for quantitative high throughput screening. We can integrate human metabolism if you have a concern for your compound being metabolized. We have good sensitivity and specificity metrics so far. We're continuing to increase the number of compounds we screen, of course, and to get a final number for that. And we have used this to model 2 different genetic causes of spina bifida. I just showed you one in this particular talk, as well as one genetic cause of autism spectrum disorder. So overall, we think our tool, the RosetteArray platform, is a really good tool for interrogating sort of this larger question of what causes human neurodevelopmental risk. And this tool can be used to look at both genetic and chemical risk factors for causing these neurodevelopmental, birth defect, and even neurodegenerative, select neurodegenerative disorders. And I just want to end by highlighting that NURA, we're here to partner with you to help make your discovery and development pipelines faster, decrease risk, decrease costs, as well as just be sure that things going out into the general public have good human safety assessments. So we provide contract human DNT screening service. You can send us your compounds, we'll run it and provide the data back to you. We have a really good turnaround rate there. Or we can help you establish this assay at your own facilities if you want to bring it in-house. We have RosetteArray plates and consumables that we can provide to you, both plates and cells. And we have access to our Rosette Detect image analysis software online so that you can conduct the assay and upload your images to our platform and analyze them in the same way that we do it. And we also are interested in partnering with people for disease model development. Currently, spina bifida, autism spectrum disorder are areas that we have data for. We're continuing to explore other neurodevelopmental disorders as well. And of course, once you have those models, we can use them for precision medicine drug discovery as well. So with that, I will take any questions, and thank you for your time and attention.
Thank you so much, Dr. Ashton. We do have time for questions. If you have more, you can keep putting them in the chat, in the Q&A module. And if you have a particular question that you want answered, go ahead and like it, and I can prioritize that one in case I run out of time. The first question that came in is about the origins of your cells. Are the human pluripotent stem cells derived from embryonic stem cells or induced pluripotent stem cells?
Yeah, so the workhorse that we use in-house for screening is the WA09 H9 human embryonic stem cell line. This was one that was approved by the Bush administration years ago, one that is stored and housed at YCell, has been for the last 20 years, will be for the next 50. And this is sort of a workhorse line of Wisconsin. We have done our platform now with 3 different iPSC lines, and we can get iPSC lines to work in our assay. It's typically just based on how you're culturing them. But for all the human embryonic stem cell line, as well as 3 different iPSC lines across African American, Asian, and Caucasian backgrounds and genders, male and female, we can get those lines to work. So if you have a cell line that you want us to use, then we can actually get that cell line from you. It is your material, it's not ours. We'll create our platform with that cell line, do the screening, and then you have the option to get those cells back, or we can just destroy them if you no longer want those vials.
Thank you. A question about the S9 used. Is it human or rodent or some other species?
That is pooled human S9 liver fraction. This is a Thermo Fisher product that we buy directly from them.
Will these assays be added to the CompTox chemical dashboard, ToxCast, or Tox21 platforms?
So the blinded screen that we're doing with the EPA right now, that data is scheduled to go into that ToxCast platform, the ChemTox platform that the EPA sort of houses. Basically, we're doing the screen, which in a blinded fashion, which means that they provide us the chemicals. We don't know what they are. They tell us the wells for the chemicals that we've identified as being sort of those reference developmental neurotoxic compounds. And so we screen them, and then we actually send them the data, and they do the analysis in their ToxCast pipeline. And so that is how we're doing this collaboration. So all of that data, once we're done and agree upon how to identify the hits and everything, then that should go into the ChemTox database so that everybody can see that data.
Yeah, I think a couple of these questions may have already been answered, but I'll just ask them for clarity. What are the chemicals that are used as vehicles for dosing? What is the criterion that limits the vehicle concentration in the wells, and do the results vary with the selection of the vehicle?
Yes, so that's a good question. Our standard vehicle for solvating compounds is DMSO. If compounds can be solvated in water, then that's perfect. We dissolve it in PBS and we use it within our assay. The criteria for the concentration that we can use of DMSO is based on when we see a observable effect in any of our metrics. And typically the most sensitive is rosette formation. So for DMSO, the dose response that we ran, we saw that well, I can show you that real quick. Here. Am I still sharing?
Yes.
Okay. So for DMSO, as you can see here at 0.1%, that is our last measured concentration where we don't have any effect. And so that is the highest concentration that we'll use DMSO. If you have another solvent, and you think it will work in cell culture, we're willing to work with you to figure out if we can run that compound or that solvent in our assay and at what concentrations we can use that solvent or levels we can use that solvent where it won't cause any effect in our assay metrics. And then we can run a screen at those levels and down. That was kind of a multi-part question.
Yeah.
Was there another part of that question?
Oh, where did it go? Do the results vary with the selection of the vehicle, perhaps?
So because we test it, I mean, that's always a possibility, although I think it's unlikely. So because we are testing to make sure that we're using a vehicle concentration that is below any effects seen in our assay, then those results should not vary. The only limitation is, of course, we can't test above that effect level because that's not going to give you a good result.
In the ToxCast screening slide, permethrin was tested twice. One was negative and one was positive. Can you explain the reason for this? Where was the quote reference data in this slide derived from?
Wow, somebody's really paying attention. That is a great question. So there's an asterisk here because we started off with compounds that we provided initially, just to see how the assay would perform and just to help us get used to running these screens. And this was permethrin that was provided by NURA. And when we tested this permethrin, we have the CAS number here. We had positive hit for permethrin. That is the dose response data that you see here for permethrin. So it was a low risk compound. And so, that was what we tested in-house. When we got chemicals, again, these were blinded from the EPA ToxCast. This should be the same chemical when it was unblinded to us. But for whatever reason, we didn't have a positive hit when we tested it in the blinded manner. And so that is something that we would like to look into. We're not exactly sure why that occurred. In that online manuscript, there are a number of compounds here that have been in this blinded screen that we tested, that we had tested previously, and that's in that bioRxiv manuscript online, that we see the same results. So we're not exactly sure why this was different, if there was a mix-up in the wells or something. That's always a case. The ToxCast plates, there's 1,072 compounds in those across multiple plates. So we're not exactly sure is the answer as to why we didn't detect it again. But overall, that seems to be an anomaly in our screening assay, because we've tested other ones like diacloprid, rotenone. You can see rotenone here, where essentially for rotenone, we could actually tell that it was rotenone when we saw the screen, because nothing has ever been that sensitive in our assay. So when we saw the curves, we were like, oh, that looks just like the one we tested before. And so we've done a number of duplicate tests between ones that we've done in-house prior to this particular project that's in that bioRxiv manuscript, and ones that we've tested with the EPA. And by and large, we see the same results. Permethrin is the one anomaly.
The next question is, are you planning to add this assay to the DNT in vitro battery at OECD? Did you have any interaction with them, and what is their feedback?
Yeah, that's a great question. So we have had interaction at the Constance, Germany meeting, which is the international DNT5, like the 5th International Conference on Developmental Neurotox. We presented this there, and Ellen Fritzsche, who has done a number of these assays, also a co-founder of DNTox, who provides some of these assays from the in vitro battery, or maybe all of them, I'm not exactly sure. She was there. We got a good reception because in this in vitro battery, one of the things that they actually mentioned is there is no standardized assay for rosette formation. And that is exactly what we have, is a standardized rosette formation assay. They mentioned that explicitly in the in vitro battery guideline as an assay that needs to be developed. And so hopefully we're providing that assay. What we're doing with the EPA now is validation. There's a well-defined process, as I found out, to go through before the OECD will recommend your assay. And that includes some validation of your assay in independent laboratories, as well as the data that we're creating right now with the EPA. And then, you have to go through the OECD docket in order to get them to look at a potential draft guideline. So that's the process that we're on now. That's a multi-year process. But overall, the standardized rosette formation that was noted as missing in that in vitro battery is exactly what this RosetteArray assay provides.
And that actually answered one of the questions I had. Oh, we got a couple questions still. We have a few minutes left. Oh, I don't know if I know what this question means. Let me throw it to you. Please talk about the micropattern subtract in your plate.
Substrate, I think it's just a
Okay,
typo.
okay.
Yeah, so this micropattern substrate, essentially it's a gold-coated slide, gold-coated surface that we then grow polyethylene glycol brushes off of in a pattern format. The polyethylene glycol brushes resist protein absorption. So wherever that brush is, you won't have any proteins absorb, and therefore you won't have any cells adhere to this surface. I teach this in Biomaterials 430 here at Wisconsin. And so we essentially micropattern that growth of the polyethylene glycol from the surface. This is a very safe compound, non-toxic. You have multiple food products that have polyethylene glycol in them that you ingest. And so we have had no issues with toxicity to the cells. And essentially, when you get the plate, you can incubate it with your ECM of choice. We typically use Matrigel, or you can use a defined laminin. Those typically work quite well. They absorb in the areas where the polyethylene glycol brush is absent, and that is those little circular areas. And then you, after coating, the next day you come in, take off the media and seed your cells into the plate. And it's just like seeding a regular 96-well plate. The cells will only adhere where the extracellular matrix protein has absorbed, and that's how you get the patterned rosette tissues.
Can you comment on the sensitivity of your RosetteArray assay compared to the DNT battery assays in terms of evaluating the DNT potential of the chemical compounds?
So I can't do that yet. What I will say is, if you look at that OECD guideline, the overall sensitivity that we're seeing in our screen so far, let me get to that slide, sorry, is on par with the battery. And the specificity, of course, we have to do more compounds. And we don't, we're at 50 compounds now, 31 compounds that should cause DNT effects. So we don't expect that sensitivity number to change really much at all. May go up, may go down a little bit, but by and large, we'll be above 80% when you just do the numbers. And so we are testing compounds that have been tested in the OECD guideline. And so what we plan to do once we finish this compound screening, we plan to go up to about 80 or so compounds. So we can increase our negative controls as well as hit a few more compounds that are of interest. And then we will be able to do that comparison with the OECD guidelines. So that is something that we are hoping to finish up the testing with our 4-brain RosetteArrays assay. Again, this is without any metabolism, but just the 4-brain RosetteArray assay. Hopefully we'll finish that up within the next 1 to 2 months, and then a manuscript will be coming out with that comparison. So we do plan to do that, but right now it seems to be largely on par with the sensitivity that you see from the overall battery.
Okay, I think I have time for one more. Can you also comment on the potential use of your assay for subchronic and chronic exposure of chemicals?
That is a good question. And I guess I would just want to define subchronic versus chronic. Subchronic being acute versus chronic. So basically the 96-well plate assay that we run is really just modeling that first initial period of neural tube formation. So past that, we're not assessing that exposure level. So if you're thinking of chronic, like over the entire course of development, or embryonic or fetal development, then we're not going to be able to do that in our assay. We're really looking at that early stage. Now, in the assay, we're exposing the cells to that compound from the pluripotent state through the rosette formation state. So that's basically a 7 or a 5-day period. And so whether you call that chronic or not, depending on what you're evaluating, that is the exposures that we run. And so over that period, we'll see really good cytotoxic indication of just killing all the tissues in the well, if it is indeed a cytotoxic concentration, or if it's just inhibiting tissue formation processes that it ultimately cause a lack of rosette formation, which really integrates all of the pathways that are necessary to do that, then we'll see it. So that is how the assay is run. Whether you call that subchronic or chronic, I will leave to the questioner.
All right, well, thank you. We have run out of time. But I did want to just say thank you to everyone for submitting all of your questions today and having a really engaging discussion. I would like to say a huge thank you to Dr. Ashton for sharing your expertise with us today. With it, we hope to expand the use of NAMs like this in a regulatory context. I wanted to thank my NURA team, especially Allison, who's been working behind the scenes to make this webinar run smoothly. And finally, thank you all for coming today. The recording will be posted shortly. You'll receive a link in the follow-up Zoom emails, or you can find it at pcrm.org/NURA. So feel free to send it to anyone who may be interested. And don't forget to sign up for our mailing list to stay informed on upcoming webinars. Thank you, everyone, and see you soon.